Hi all, Dr. Lisa here. This is my supervisor, Maya. She's decided to join us today. What I wanted to talk to you about today is adenomyosis. What is it? What's its impact on fertility? And maybe some things that you can do to help deal with it. So a lot of people know about endometriosis, and I actually have a video on endometriosis. Endometriosis is what happens when the uterine lining cells, the endometrium, actually migrate out into the abdomen and in other areas of the body and cause problems. And one of the reasons endometrial cells are problematic is because they are sticky and they don't die, and they can interfere with both the process of nurturing a follicle and ova, and also interfering with implantation process. So that's what endometriosis is. What is adenomyosis? It's the easiest way to conceptualize it is adenomyosis is like endometriosis, except inside your uterus. And what happens is that instead of shedding cleanly and only growing in the uterine lining, the endometrial cells grow into the wall of the uterus itself and create patches, usually, because it does tend to be in like patches in the uterus, where the cells are so thick and sticky that they don't shed the way they should and don't act the way they should. So adenomyosis is like endometriosis inside your uterus. So why is this a problem for fertility? Well, as you know, one of the things that we need to have happen in order to have a successful pregnancy is successful implantation of an embryo. And if the uterine wall, or when the uterine wall is healthy, what happens is the embryo comes in and is close to the uterine wall, and it actually sends out hormonal signals to your uterine lining that says, hey, incoming, make a space, make way, make way. And these hormones actually help dig a hole in your uterine lining. Your uterus also sends up these little arteries called spiral arteries, which do exactly what the name says. They spiral up, latch on to the embryo, and then draw it down into that lovely little cave that has been made in your uterine lining so that the embryo can implant in there. And then your uterine lining heals itself over that, and that's how your body knows it's pregnant. If there's anything that interferes with implantation, particularly in the case of if the uterine lining is sticky, then what happens is two problems. One, you don't always get those spiral arteries coming up and latching onto the embryo to guide it down into the uterine lining the way you want, because sticky means that the spiral arteries can't form and move up the way they need to. And sticky also means that that nice little cave that that embryo is supposed to implant into doesn't get made the way it needs to. So it's kind of like when you plant a seed and you're feeling kind of lazy or you're rushed, and you just, kind of generally scratch out some space on the dirt and throw the seeds on there and then maybe cover them, haphazardly with dirt. It's the same sort of thing. Instead of implanting deeply and beautifully into the endometrial lining, it's almost like the embryo gets stuck in the mud and doesn't implant correctly. And if it doesn't implant correctly, then it isn't going to develop into a healthy pregnancy. So the issue with adenomyosis is that it affects the uterine lining because it makes it sticky and gooey in places. And it appears that if the adenomyosis is not in the areas where implantation tends to happen, which is high up in the uterus and in sort of on the back of the uterine wall, then it's not as much of a problem. But if there are patches of the adenomyosis in places where the embryo would normally implant, then it creates a problem for implantation and therefore a pregnancy. So the question becomes, how do you diagnose it? So there are two ways. Transvaginal ultrasound actually has a pretty decent rate of diagnosis, and it can be like between 70 and 80% accurate. An MRI is kind of the gold standard. They're a little bit more expensive. They're a little bit harder to get your insurance to cover. But if there are questions about adenomyosis, then it might be worth getting an MRI. The studies linking adenomyosis to infertility and the rates of infertility are not as strong as we'd like them to be. There aren't as many as we'd like to see, but in general, this has been studied primarily in terms of IVF and success rates of IVF. And so we're going to go back to endometriosis for a little bit. There is significant association with pelvic endometriosis and adenomyosis. What that means is that you often find adenomyosis in the same body that has endometriosis. And that's about a 54 to 90% correlation. So more than 50% of women who have endometriosis also have adenomyosis. To me, that makes a certain amount of logical sense, because if your uterine lining is not behaving correctly and it's migrating out and it's sticky, why wouldn't it also have the same sorts of problems internal to the uterus? There are studies, and they are animal studies, which means, of course, it's not 100% correlation, but there is a strong association between adenomyosis and infertility in animal studies. In a study of women who received embryos through donation, so this is a donor embryo IVF transfer, the rates of miscarriage were much higher for women with adenomyosis than those who had just endometriosis or the women who didn't have anything at all. So it does actually affect IVF implantation rates. And because implantation is implantation is implantation, there is a strong reason to believe that adenomyosis can actually affect the fertility of women who are trying to conceive naturally too. So one of the things, so then what do you do with that? Because, you know, the question is always, well, if I have this thing, first of all, how do I find out if I have this thing? And secondly, what do I do about it? So how you find out if you have adenomyosis is this. First of all, if you have endometriosis, please go get checked either through transvaginal ultrasound or MRI through your OBGYN, and ask them to either, you know, confirm or rule out the possibility of adenomyosis, because knowing if you have it or not will help you figure out the next steps of what you want to do. Remember, transvag or MRI can be used in this particular case. And the second thing is, what do I do? Well, endometriosis is tricky. If you go over and look at my endometriosis video, I talk about, you know, some of the things that you can do to help deal with it there. Adenomyosis, from a Chinese medicine point of view, is actually in the same family of blood disturbances that endometriosis is. So from a Chinese medicine point of view, adenomyosis is in the same, is basically what we call blood stasis. It's stuck blood. It's blood that isn't moving or acting the way we want it to, which makes sense because that's exactly what it is. There are generally three causes of this blood stasis issue, and they are too much heat, not enough heat, or what we call liver qi stagnation. If you have too much heat, you would look at that on a basal body temperature chart, and what you would notice is that your temperatures generally are out of range of what we would consider healthy. If you don't have enough heat, your temperatures would be lower than we expect them to be, and this is on both pre and post ovulation in the basal body temperature chart. And then if you have liver qi stagnation, what that basically means is that the blood is doing okay, but it's not moving the way we want it to. That's the stuck part of it. And that often shows up on the basal body temperature chart as spiky temperatures, or you'll notice that when you have a really frustrating, irritating, time during a cycle, that you'll see more spikes than usual on your basal body temperature chart. You can also just track it with your emotions. If you're feeling frustrated and irritable and angry, and it doesn't take much to get you into those emotional states, then you probably have a little bit of liver qi stagnation, and that's going to show up both in your fertility and on your basal body temperature chart. So what can you do? Well, if you're dealing with the liver qi stagnation type or aspect of blood stasis, then taking steps to not be as irritable and angry is really good. You can do meditation, you can go for a walk, you can do the things that helps you bring you back down to calm and out of irritation, and make them part of your day-to-day life. Because let's face it, Yes, it affects your fertility, but irritation like that affects your life in general and everybody around you. And it's always better not to feel constantly frustrated and irritated with the world. If you're tending to run hot, then you need to take common sense measures like don't take baths, don't take, hot showers or like hot showers, don't do saunas, don't do jacuzzis, don't create extra heat in your body, don't sleep under, 3 blankets or keep the temperature at 78. These are all things, by the way, that I've encountered in my practice, because your overall temperatures will be higher and your body is not dealing with the heat particularly well. And one of the ways it's showing up is it's causing a, disharmony in how your blood is reacting in particular, and relevant for you in how your, blood having to do with fertility is reacting. Also eating really hot food, like either thermally hot or chemically hot, super spicy, super like hot food that makes you sweat like crazy and makes your nose run. This is really bad for anybody that tends to run hot in fertility because it's just adding on the internal heat. And if you tend to run cold, it's the opposite. Don't keep your room cold at night. Make sure that you bundle up. Keep warm, because your body is consuming a lot of your energy trying to stay warm, and as a result, doesn't have enough to give to fertility to help your blood move more harmoniously and to keep things where you want it to be. Eat warm, nourishing food. I still would stay away from the super spicy stuff, but warming spices like ginger and cinnamon and those sorts of things are really good for you. If you run hot, do things to help cool you off. If you run cold, do things to help warm you up. And if you're irritated and frustrated all the time, take the steps you need in order to create sort of more emotional calm and evenness. So that is the conclusion of the discussion on adenomyosis. If you have endometriosis, please go back and ask your OBGYN to check you for adenomyosis. And if you have adenomyosis, think about or consider looking into some of the causes from a Chinese medicine point of view of what might be creating it, so that you can take steps to help your body regulate itself and create healthier position for fertility. Thanks so much, and see you soon.